JD Arsan from BSN2C. Now, I am going to perform on how to assess the newborn care. So, first is time band the perineal bulging with presenting part visible. Standard essential newborn care practices guidelines are organized by time, beginning at the time of perineal bulging until 1 week of life. So, next is our assessment and planning. Gather all necessary materials and equipment needed. So first is prepare for the delivery, assembles needed materials according to the sequence of use. 2 sterile gloves, 2 clean towel for the drying and wrapping the baby, bonnet and identification band, cord clamp, forceps, scissors and kidney basin, oxytocin, eye antibiotic, vitamin K, BCG, and Hep V vaccine, mittens and socks, making sure all equipments are needed are available to avoid delay or minimize waste of time. Next is to ensure that the delivery area is drop free and between 25 to 28 degree using a room thermometer. This is to avoid hypothermia can lead to infection, coagulation, and defects. Acidosin, delay, fetal newborn circulatory adjustment, hyaline membrane, and disease and brain hemorrhage. Next is wash hands with clean water and soap to infection control. Next is double gloves just before the delivery. 1 gloves will be used during the delivery while the other gloves is for cord care. Next is time band. Within the first 30 seconds, call out the time of birth. Dry and provide warmth. Assess the Apgar score cord and repeat the after 5 minutes. This is to avoid the hypothermia and to ability to adjust extra uterine life. Use a clean, dry clothes to thoroughly dry the baby while wiping the eyes, face, and back arms and legs. Remove the wet clothes. And then next is do a quick check of newborn's breathing while drying. Okay. Next is do not ventilate unless the baby is flappy, lip, and not breathing. Do not suction unless the mouth, nose are blocked with secretion or other materials. Unnecessary. Unnecessary for neonates do not have black materials or nose or mouth. Time ban if after 30 seconds of thorough during newborn does not breathing or gasping, reposition, suction, and ventilate. This is to ensure that adequate ventilation of the lungs, oxygenation of vital organs such as heart and brain, and initiation of spontaneous breathing. Clamp and cut cord immediately, call for help, transfer to a warm, firm surface, inform the staff that the newborn has difficulty breathing, and endorse the newborn to the staff. Time ban if after 30 seconds of thorough trying, newborn breathing or cry. Do skin-to-skin contact if a baby is crying and breathing normally. Avoid any manipulation such as routine suctioning that may cause trauma or introduce infection. This is to maintain maintenance of warm and sustained breastfeeding. Place the newborn prone of the mother abdomen or chest, skin to skin. This is to avoid hypothermia, and cover newborn back with a blanket and head with a bonnet. Next is place identification band on ankle. Note, do not separate the newborn from the mother as long as the newborn does not exhibit severe chest injuring, gasping, or apnea, and the mother does not need urgent medical stabilization. And do not put the newborn on a cold or wet surface. Do not wipe off cervix if present. Do not ban the newborn earlier than 6 hours of life. Um, um, if the newborn must be separated from his or her mother, put him or her on a warm surface close to the mother. And next is, if the baby is crying, breathing normally, avoid any manipulation such as suctioning that may cause trauma or introduce infection. Time band, 1 to 3 minutes to delay or non-immediate cord clamping. Remove the first set of gloves immediately prior to the cord clamping. The second gloves is not contaminated during the delivery. Next is clamp and cut the cord after the cord pulsation and typically at 1 to 3 minutes. Put ties tightly around the cord at 2 cm and 5 cm from the newborn abdomen. Cut between ties between sterile and instrument. Observe for oozing blood. Leave the newborn on mother chest in skin-to-skin contact. Observe the newborn only when the newborn choose feeding cues. My verbal suggestion to the mother to encourage her newborn to move outward the breast and counsel on positioning and attachment when the baby is ready. Advise the mother to make sure the newborn's neck is not flexed nor twisted. Make sure the newborn is facing the breast with the newborn nose opposite nipple chin touching the breast. Hold the newborn body, close her body, support the newborn full body, not just the neck and shoulder. Wait until her newborn mouth is open wide. Move her newborn onto her breast, aiming the infant lower hip well below the nipple. Look for sign of good attachment and sucking. Mouth wide open, lower lip turn outward, baby chin touching the breast, and suckling is slow, deep with some pauses. If the attachment or sucking is not good, try again and recess. Provide additional care for a small baby or twins. For a visible small newborn or newborn 1 month early, encourage the mother to keep small newborn in skin-to-skin contact with her as much as possible. Provide extra blanket to keep the baby warm. If mother cannot keep the baby skin to skin because of complication, wrap the baby in a clean, dry, warm cloth and place in a cover with a blanket. Use a radiant warmer if the baby is small. Do not bath the small baby. Ensure hygiene by wiping the damp cloth, but only after 6 hours. Next is prepare a very small baby or a baby born 2 months early or referral. Do eye care, administer an azithromycin or tetracycline ointment or 2.5% povidone iodine drops to both eye after newborn has located breast. Apply the inner to outer canthus with tubes tips not directly touching the body lids. This is to prevent ophthalmia neonatorum. So, do not wash the eye antimicrobial. Time ban for from 90 minutes to 6 hours. Wash your hand. Next is inject the single dose for vitamin K1 mg IM at the baby's middle third lateral aspect of the vastus, laterally either right or left. Number 3, inject hepatitis B intramuscularly and BCG intradermally, and record and thoroughly examine the baby. Look for possible birth injury, bumps on one or both sides of the head, bruise as well, swelling on buttocks, abnormal position of legs after breech presentation, or asymmetrical arm movement, or arm does not move. Look for malformations, cleft palate or flat foot or looking unusual appearance, open tissue on head, abdomen or back. If present, cover any open tissue with sterile gauze before referral and keep warm. Refer for special treatment and or evaluation if available. Help mother to breastfeed. If not successful, teach her alternative feeding methods. Uh, do anthropometric measurement and get the measurements. And the last is wash your hand. Encourage the mother to keep her small baby in skin-to-skin contact. If mother cannot keep the baby in skin-to-skin contact because of complication, wrap the baby in a clean, dry, warm cloth and cot. Cover with a blanket. Use a radiant warmer if the room is not warm or the baby small. Do not bath the small baby. Keep the baby clean by wiping with a damp cloth, but only after the 6 hours. Clothe, then wrap the newborn. Document the procedure. So that's all for the newborn care.